Welcome back to our conversation with the community with Senator Maggie Hassan. We're going to bring in our town hall of New Hampshire voters here now. Questions from this audience. We'll also have questions from the digital space coming in as well. I might jump in for a follow-up if necessary, but we want to get things started right away with Mr. Eric Drouhart.
Thank you. Thank you, Senator. My question is, what can average citizens do to resist against this administration and its inhuman treatment of immigrants, especially those that came because of security concern in their home countries?
Eric, thank you for the question. Thank you for being here today. And thanks to MUR for hosting this and for all of you for participating. Look, this is a really obviously difficult time. We have a president who, instead of addressing costs and helping people become stronger at home, building a better future for themselves, is really created chaos, corruption, and really in many cases has acted with great cruelty, as his administration. And it's critically important that we stand up to that, as so many people around the country have. It's critical that we work to hold this administration accountable. This is a challenge in Congress right now because we have an administration that believes it's neither accountable to the rule of law or to Congress, which is a different place for Americans, for people in Congress, for American citizens to be. So I would encourage people to continue to speak out about what you see. It's critically important when it comes to immigration and the tactics that ICE is using right now to both stand for security. It's important to have a secure and safe border. It's important to know who's here in the country. It's important that we have interior enforcement that roots out undocumented people who pose a significant violent threat to our communities. But our law enforcement, whether they are ICE, whether they are local law enforcement, they need to act according to the rule of law and honor due process. And we're seeing great violations of that around the country. So continue to speak up. When people raise their voices, other people do listen. I am pushing my Republican colleagues in Congress to push back at this administration more. I will continue to push the chairman of my committee, Homeland Security Committee, Senator Paul, to have oversight hearings so we can push Secretary Noem on what's happening here. And I'll also try to urge the administration to recognize that most law enforcement around this country, and especially here in New Hampshire, act with great professionalism, integrity, and follow the rule of law. And it is time for ICE to do the same thing.
Quick follow, Senator. Do you agree with the calls to abolish ICE?
We need to have strong interior enforcement. It is very important that we root out people who have convictions in their record for violent crime if they are here undocumented. That would make our communities safer. This is about ICE not following the rule of law, not following due process, going into homes without warrants, not using the best practices that I know so many law enforcement officers use here in New Hampshire and around the country. So it also really highlights the need for bipartisan immigration reform. Last thing I'll say is that President Trump and Secretary Noem said when asked that they would target violent criminals who were here illegally, and that they would work to detain and deport after due process those violent criminals. They have broken that promise.
Next question comes from Karen Bemis.
Thank you. Thank you, Senator. You recently introduced the Stronger Start for Working Families Act to modify earned income threshold for the refundable child tax credit. How do you plan to build further bipartisan support to ensure this tax credit reaches the 3.5 million families it aims to help in 2026?
Well, thanks so much for the question. As you know, I have sponsored that legislation with Senator Todd Young from Indiana, so it is bipartisan legislation. And one of the areas of agreement that Republicans and Democrats in Washington generally have is that hardworking families should be able to get tax cuts. And if this bill passes, hardworking lower income families could get as much as a $300 tax break or a $300 refund of taxes, which is real money when you're trying to pay the bills at the end of the month and maybe have a little bit extra left over so that your kid can join soccer or Little League, right? So we will continue, Todd and I will continue to talk with our colleagues on both sides of the aisle. It is unconscionable to me that the Republicans last spring passed massive tax cuts for billionaires and corporate special interests, but that we're having to work so hard to just help working families keep a little bit more of their hard-earned dollars. Thank you.
Next question comes from Monica Joyle.
Hello, Senator.
Hi.
You have represented New Hampshire both here as the governor and in D.C. as our senator. And the common issue of both parties is affordability.
Yeah.
But what is the key issue of the Democratic Party in the next 2 years? And how does this help voters directly here in our state of New Hampshire?
Okay.
Thank you.
Thank you so much, Monica, for the question. Look, at the end of the day, what I hear from my constituents, regardless of what political party they belong to or if they belong to a political party, right? Here in New Hampshire, we're mostly independents, is that they want to be able to work hard and build a better life for themselves and for their kids, right? And that means making sure that they can pay the rent and energy costs, transportation, health care, child care, and maybe save a little bit for retirement, for college, for an emergency, right? That's what people want to be able to do. And that's why we are so concerned about the high cost of living right now. It's the high cost of the necessities, right? Groceries, rent, mortgage, you name it, people are really struggling. So when you see us talk about affordability, what we're really focused on is what immediate steps can we take so that people can live that American dream, because that's what the democracy is supposed to deliver, right? Why do we care about democracy? We care about democracy because it allows people in New Hampshire and all across the country to tell us what their priorities are and then to hold us accountable. And the democracy has to work so that people can have this opportunity to build a better life. So first thing I want to do is repeal the president's tariffs. I'm the top Democrat on something called the Joint Economic Committee. We just issued a report. We studied using the same method that the committee did when President Biden was in charge to look at what inflation has cost the average family across the country and in New Hampshire. And in New Hampshire, the average cost of inflation, driven mostly by the president's tariffs, has been an additional $2,100 in expenses. It's about $310 in groceries. Those tariffs are a choice that Donald Trump made, and we need to repeal those tariffs. We also need to increase the supply of housing so we can bring down costs and make sure that we're building more starter housing. There are lots of good ideas about how to support that. We need to address the cost of health care, of course. But at the end of the day, this is about honoring people's freedom and liberty to build the life they want and to make sure that as they do, their hard work is rewarded.
Thank you.
Thank you.
Next question from Thalia Flores.
Welcome, Senator Hassan. Thank you for taking my question.
Sure.
You are a senator known to work behind the scenes in bipartisan negotiations to pass critical legislation. The people are not privy to the discussions that often lead to 11th-hour deals directly impacting their lives and livelihoods. How do you provide transparency and trust into that process? And what are your non-negotiables when it comes to representing New Hampshire?
Thank you so much for the question. Look, the process of legislating, the process of delivering for the people of the Granite State and the people of our country is a very human one, right? And so it is important that legislators build relationships, get to know each other, share common interests. One of the things that's really important to me is when Granite Staters say to me something like, I don't think I can ever afford a house. You know, a 30-year-old says to me, I don't think I'll ever be able to afford a house because I'm looking around at the housing stock and the prices, and I'm looking at how much I can reasonably bring home working 40 or 60 or 80 hours a week. When I hear that, that's my opportunity to say to a colleague from another state, maybe another political party, hey, are you hearing the same thing? Sometimes they're not because the situation in their state may be a little different. Maybe I can learn from that. Sometimes they are. And that's when we can come together and begin to build legislation like the one we just talked about that's bipartisan to make sure that more hardworking people can keep more of their hard-earned dollars. Having said that, we also have a committee process in Congress so that when we are considering legislation, we have hearings in public, and we also have the opportunity to discuss legislation or these big bills, sometimes that are budget bills, on the Senate floor so people know what's in them. But part of our problem has been, in recent years, that there's been so much division and so much unwillingness to compromise that what happens is the leaders in House and the leaders in the Senate, both political parties, do go behind closed doors and they negotiate a deal, and then it's presented at the 11th hour. They often talk with members about what we would want in a deal, but it doesn't give citizens the sense of participation that they need. And I think it's going to be really important moving forward. It's something we've been trying to do and we're making some progress on, to make sure that bills go through what we call in the Senate regular order. They have a hearing. People can watch it on TV. People can stream it at the end of their workday. They can hear about it. They can reach out to us. They can tell us what they think about it, what they think will and won't work. One of the things that I think people aren't paying much attention to right now, but as the result of the agreement we made to reopen the government in November, we insisted that we return to the regular budgeting process, the regular appropriations process, a bill by category at a time. And we're actually making progress in that in a way that has allowed public participation. We've got a long way to go, but the other thing people can do is just raise your voices, pay attention to what you're seeing, on C-SPAN. Look at the areas you're interested in, find out what committees cover those areas, and then also support those of us who are calling on the Republicans in Congress to hold more public hearings on the things that matter to our constituents, and to hold more accountability and oversight hearings on this administration, which has been a real challenge because they're not responding to the usual. Usually in most administrations, if Congress says, please come before your oversight committee and talk to us about what's going on, in every other administration, they do. And right now, the Trump administration is refusing often to come talk to us. Thanks.
Thank you.
Anina Hansen has the next question.
Thanks, Senator.
Hi.
Interventions like naloxone have thankfully reduced our overdose fatality numbers, but as a person in recovery from alcoholism who lost my life partner to a fentanyl overdose, I'm troubled by the ongoing issues with substance addiction in our state. I so appreciate the recovery champion you've always been. What is your current plan for expanding addiction prevention and treatment in New Hampshire? And do you think we can do more on the prevention side by increasing our efforts to address childhood trauma?
Anina, thank you for the question and congratulations on being in recovery, and I'm so sorry about your partner. And this is sadly one of the stories I have heard over and over again in New Hampshire since the time I was governor. The opioid epidemic was already hurting us terribly, harming so many people in New Hampshire, and then with the advent of fentanyl, it became even worse. So one of the things we've been able to do this year in a bipartisan way is reauthorize something called the SUPPORT Act. That was something that I had hoped we would pass last year. This is a piece of legislation that makes sure that we are funding our first responders so that they know how to respond to an overdose and save a life. It also provides support and funding for recovery centers to provide more treatment so people, when they decide they're ready to enter recovery, they can get into a treatment program right away and then have the support they need to tailor a treatment program to support them. So we have passed that SUPPORT Act in a bipartisan way, which is providing more funding and more prevention, but we have a lot more work to do. As you also know, we have taken away some of the paperwork, the bureaucratic barriers that doctors faced in prescribing medication-assisted treatment so that primary care doctors, emergency room doctors faced with somebody who is addicted to fentanyl can begin to prescribe that gold standard of treatment right away in the setting when that person may have come in to be treated for an overdose. We have a lot more work to do. I continue to push for more funding, for more mental health support. When you talk about childhood trauma, we obviously know that many people who struggle with addiction have had a particularly high level of childhood trauma. One of the things that is really important that we worked in a bipartisan way in 2022 to do was provide more support for mental health services in schools in an age-appropriate way so that we can work on these prevention issues early on. Just last week, the Trump administration notified a number of the school systems, for instance, that had these grants at midnight that the grants were canceled out of nowhere. These are grants that fund, in one of our school systems, about 10 mental health workers, social workers in the school system. The good news is the people of New Hampshire spoke up right away. We were able to write a letter the next day and push the administration, and within 24 hours they reversed course. Right now, we are sadly playing defense here to try to keep the levels of funding we have, but we will continue to push hard. This is not a partisan issue, and this is critical to our health and to our safety and to our future. And so I thank you for being an advocate. I thank you for telling your story, and I'll continue to work with you and so many other people in the recovery community to make us stronger.
Okay, Senator, we've got a question coming in from the digital space. A few people asked this one, actually. Tom Williams asks, what is your answer, Senator, to the question posed to Dr. Nisha Verma last week, can men get pregnant?
People who are biologically male at birth cannot get pregnant. But what I want to focus on, look, that was a hearing in the HELP Committee, Health, Education, Labor, and Pensions Committee, about the safe use of mifepristone, which of course is a drug that has been approved and used safely and effectively to help women have medication abortions for decades now. It's used globally. It is safe, it's effective. There have been over 100 clinical studies that show that. And sadly, what the Republican majority on my committee did was try to turn that into a hearing where they cherry-picked data, where they asked doctors that question, intended to be a very divisive question, rather than focus on the need for women to get health care when they need it, where they need it, whether it is abortion care, whether it is appropriate care for a miscarriage, whether it's prenatal care so that they can have a safe and healthy pregnancy. Ever since the Dobbs decision was decided in 2022 and states began to ban abortion around the country, and even in New Hampshire putting more restrictions on abortion so that there's more red tape for doctors and patients to go through if they need a late-term abortion, what we've seen is healthcare deserts, meaning that women really can't access healthcare. That's what that hearing should have been about. Sadly, it was about cherry-picking data to make people believe that a drug that has been used safely and effectively for decades is somehow unsafe.
Next question comes from Jim Adams.
Yes, Senator. The veterans in the state of New Hampshire have a wonderful method of getting their care brought to them. In fact, you and the other Senator Shaheen, you folks were part of that. Yeah. But it's called the Community Care Act.
Right.
And these folks can go anywhere they want to get, as long as they're in the system, to get their treatment. Now all the talk about a new hospital for $1.5 billion, and you and your staff have been to the SFAC meetings many times. Right. For the 4 years in a row, they voted 20-1 against a hospital. We're just, some of them have asked and say, please share with the senator that if it's not broke, don't fix it.
Yeah. Jim, are you a veteran?
Yes, I am.
Thank you so much for your service.
Thank you.
We really appreciate it. We're stronger and freer because of you and so many other veterans around the country. I appreciate that a number of veterans have talked to me about their concern that if somehow we go to a full-service hospital in Manchester, that we won't have community care available. I want both to be available. What I hear overwhelmingly from veterans in the community is that they wish New Hampshire had a full-service hospital. We are the only state in the lower 48 that doesn't have our own veterans hospital, which means that in some cases, as you know, veterans to get care at another veterans hospital have to drive either to White River Junction or down to Boston. And that's untenable for a lot of our veterans. So I continue to believe, and this is an area that I actually agree with President Trump about, that we should have a full-service hospital. I also want to make sure that in appropriate circumstances, community care is available. But I also want to point out to folks that our community care system, our civilian healthcare system, is also under great strain. So we need to strengthen both, and I think it's not mutually exclusive. We can have a full-service hospital, but also have community care available for those veterans who choose to do that, and I'm committed to both. Thank you.
Okay, Senator, we're close to the end here.
Okay.
It's Sunday when people are watching this, the AFC Championship game. If the Patriots win, how do you trash talk Senator Bennett and Senator Hickenlooper?
Oh, I don't know. Boy, the Patriots game was, I mean, we won on Sunday, but it wasn't the prettiest game. I mean, just saying. And Drake May is like just amazing, and I'm really excited to have the Patriots back in the playoffs. But yes, I will be pointing out that, you know, when the going gets tough, New Englanders get going.
All right. Senator,
Yeah.
thanks so much for
Thank you.
participating. Thank you to everyone in the audience and those folks watching. That's all the time we have. You can always watch all the episodes of Conversation with the Community on WMUR.com, our free mobile app, very local, and YouTube. We also want to offer a very special thanks to the New Hampshire Institute of Politics. Thanks for watching. Have a great Sunday.
Thank you.